let us talk about your company, Peter, and how you currently, what you do in the three companies that you own, and how you're currently employing the use of AI in what you do.
So really and truly, we see AI as workforce multipliers and virtual assistants. In Open Solutions for Health, we provide digital solutions to the health domain. So we work primarily with governments across the Caribbean, particularly Eastern Caribbean. And really and truly, the goal of this is to reduce the burden on healthcare workers so that they can focus on more critical tasks. Because in the health domain, there's a lot of reporting requirements. But if a person has, at the end of the day, and the nurse has seen their patients or the doctor have seen their patients, they don't have to go write a report and then submit that weekly report and then do a monthly report while on top of all they have to do. So we try to automate as much as possible. And that's outside of AI, right? This is really just what we do in terms of providing digital health solutions.
Let me ask a question on the digital health solution.
Yes.
We have a major problem in Dominica with health and information. A simple example, I take medication. Probably all of us take some medication at some time for something. Yeah? We go down the road there, we get into an accident, the ambulance comes, it takes us off to the hospital. We get to the hospital, the doctors there are wondering, what should we do with him? Is he diabetic? You can't say because you are out of it. What medications does he take? Can we do this? Can we do that? And so on. Because the information isn't there. Because the information is with your doctor in a paper file. I don't know if his company is thinking of doing that.
It's happening already. There's a Caribbean Digital Transformation Project just awarded that to an Indian company called RCS. Very good company. And they are currently have started the process. It's going to take about, maybe 3 to 5 years.
Quite frankly, I am upset and disappointed.
No, it's a large. I know what you're going to say. You're disappointed that I'm assuming that it's an Indian company, right?
No, I know where it's from, but this is Dominica. Mm-hmm. And if Dominica's economy is to participate intelligently in the digital revolution, we must give the Dominican companies opportunity. It doesn't matter if the Dominican company, the first version they make is a buggy thing that has lots of bugs. Every software thing that starts off is a buggy thing that gets fixed along the way as they go along. Yes? But if we don't give the companies in Dominica the opportunity to develop these, some of which are relatively easy databases and so on, we're never going to get a culture of technological innovation in the country, because we can't simply participate in the digital economy as consumers.
Okay,
we have to be producers, and the best place to start the production. Right. Start the production at home. Right. Because everybody, they develop in their local economy. They get good at it, they get better at it, their products are good, then they start to export it. So if our companies are not here working on what you might say relatively simple thing, we cannot get going at all. We will simply be the consumers paying license fees. Yes, software license fees can be quite high to companies abroad.
Okay, Mark, you're obviously passionate about this, so let's see what
great points, but I can tell you that this particular project addresses most of them. So,
but it doesn't. If it to address it, it must involve the local programmers and people there.
The digital health space is a very niche and large space and a very complex space. Now, the size of the company that actually is working on that, the employees, the number of employees probably is more than our entire government. I say this to say there are certain areas, yes, I would agree with you entirely on that. Now, for this particular project, it was written in such a way so that the winning companies would work with local companies, because really and truly, it's a World Bank funded project. And because of the amount of money there is a certain criteria that you had to meet. So the first one is you had to be in the domain for at least 5 years. We wanted to bid on that project. Just how the project was created, and this is World Bank standards, right? Because they are the ones giving the money. If it was Dominican's money, because remember that they believe this is a loan, this is debt funding, not our own. It's not funded internally, and so therefore, I believe that they based on how the terms were written, I understood why it was written in that way, because we would be considered one of the largest companies of our kind in the Caribbean. And this particular project would definitely be way too large for us.
Well, here, let me explain, let me give you my point of view on that. And I interact with people in CARICOM space all the time. And Dominica's view and point of view is never taken into account. Yeah, that's the major problem. And our leaders and so on who go to these conferences accept that. I mean, I go, I don't. Okay? This is a project that the government of Dominica itself could have and should have financed. It's not a big project, it's a database.
Well, but what's the value of that project? Do you know, Peter?
I think it was about $6 million US.
Your company could do one for Dominica for a couple $100,000.
Absolutely. I believe. Okay, I see your point. Here's how I would agree with you. I used to work for the government. I used to work for the Ministry of Health from 2010 to 2018, and we actually implemented a first version of an application. The problem, however, was never. The problem is really the technology. The problem is your ability to convince the
people who make decisions.
The decision making, the bureaucratic side of it, right? Because we had a particular challenge that was more, the decision was outside of our domain to really address it, and yet still the software was being blamed for an issue that the software was not supposed to be blamed for, right? Because I think at the time the front desk where you have your receptionist closes at 4. Now everybody in Dominica, well, not everybody, I was in church once, and the pastor said, if you want free healthcare, go to the hospital after 4 p.m. But what's happening now? We have trained persons on the registration process, which is done in a very particular way to ensure you don't duplicate patients when you are registering them, when you're creating them in the system, right? You have persons with similar names, you have return visits, and so on. What was happening is you see a lot of persons coming in at night. Now, nurses who were not trained on using the system are the ones who are now writing down on paper because the front desk, who the person on the computer, is closed. And then that paper with the incorrect information at times, because they would not look at an ID to spell their name, they would try to spell it on their own. So they say, oh, your name is Anthony, I will spell it how it sounds. And when they get in to the front desk, then they would try to search for the person because the name is spelled incorrectly. Re-register the person, you have duplicates.
Let me see if I can explain that to you. We had a system, a manual system, where each patient had his patient book. So he would take it with him to every doctor he went.
Primary healthcare, yes.
And the doctor wrote what he did in them, and he saw what the other doctor did last week, last year, or whatever. It's basically to transfer that book into a computer. Because that is the basic information you need.
The concepts in medical terminologies, which you cannot just, what you're talking about is just like an electronic paper, right? If you just take what it is, you create a database. I put Peter had diabetes in free text and put it in there. But there's actually medical terminology, ICD, SNOMED. These concepts, all right, need to be understood. Not just the doctor, but the person creating the solution. And so this notion that an IT person can create a health system is actually quite wrong.
It's obvious that an IT guy, especially a guy who's in programming and databases and so on,
right?
Okay, he knows how to build a database. You who need the database have to work with him to instruct him what you need the database to do. And then he will construct it according to your wishes.
But I think
it's a question of terminology. No. The terminology.
Right.
You can either use a lot of Latinate words, or you can use simple English. So in a database where, here's the thing, who is going to be using it? What is their level of education? The person's level of education is maximum secondary school. A person who has a PhD can understand what a secondary school person can understand. Therefore, you write it for the person who has the lowest level of education.
Just one last point, though. Unfortunately, the health domain does not function as a silo. So, you could build something that works in Dominica, but what about when it comes time for that data to be shared, right? It's
shared as well.
The Pan American Health Organization, the World Health Organization.
You write the reports. You generate the queries to write the reports that the Whisperer of Power requires. You said it then.
We could have another topic on that.
The fundamental point I'm making is that here's something.
Yeah, but
no. Hold on. You just mentioned something about the person at the front desk is the one who knows how to use the computer, and the one who is there at the night doesn't know how to use the computer. What a hell of a shame. I be saying, and we should be doing that just at that long time. Every primary school child should know how to program a computer.
Yeah,
to write computer.
I didn't say they didn't know how to use the computer. I said they did not understand the methodology for registering persons.
No, well then you will have the methodology for what to teach the person, man.
Yes, and we tried that, but then because of the high turnover rate of the nurses at the front desk, at those areas, you train one today, next week you have someone else.
No, here's where the thing comes. You went to school that you learn to read. Here's a manual, read it.
So you are right on that one, and I do agree with you 100% on that. That the college or the nursing school needs to be brought in, so that everyone who is going, the next generation of nurses and healthcare professionals who are going to come into the space, come in with that knowledge already. So I agree with you on that. So that's why I say I understand the problems. I just know what it's just making sure we are touching on the right issues at the right time. Because you are right. But I think generally what you are saying is correct. I just want to make sure that we say the right, we communicate the right information from how things has progressed over time.
Okay. Yeah. All right. So essentially, I mean, the point you're making, Mark, is that the project could have been given to a local company.
The problem is that we start off on the basis that everybody abroad knows better anything and everything better than anybody here does, whatever the domain is.
True.
Like, for example, back to this programming thing there. The birth and death record is just a simple database. I'm not a programmer, but I could have programmed that with Microsoft Access. The security feature in the birth and death records, the security for the computer generally, but the security feature in the birth certificate, death certificate is in the paper. It's the paper that generates the security that this is a proper birth certificate.
The type
it's not the code that brings the paper. Yeah. It's the paper that is the security.
Okay. All right. Oh, the death certificate. Yeah. Okay. A particular special paper.
Or your birth certificate.
Yeah, birth certificate. Yeah. Okay. All right. Well, Mark, I think we've taken the point.
Back to the impact, the potential impact of artificial intelligence.
Okay. All right.
Okay. I'm in the music business.
Right. All right.
So I know recently, there a couple of years or so ago, there was a hit song by Drake. It was a total fake. Drake wasn't singing there at all.
Right.
Okay, it was voice, Drake's voice.
Right.
But he wasn't there singing. He didn't do any soft song. Okay. And everybody who listened to it was sure they were listening to their favorite star, and that was Drake.
Right.
Well, one of the big jobs, not big jobs, but large number of jobs we have is with the people doing this outsourcing thing for answering the phones for companies in the States, customer service thing.
Yeah.
Well, AI is going to blow that away.
Right.
You know?
Okay. So
we had better start, which is why we have to start thinking of how the AI is going to impact us and how we can at least get some traction out of it somewhere.
Okay. All right, Peter, let's finish. I don't know if you had finished the answering the question I asked about your companies and what they do and how AI is involved.
Yeah,
we can finish that and then we can go on to the impact, for the Dominican and the Caribbean. Yeah.
So right now, we use AI as a workforce multiplier. So like I mentioned with the Indian company, they have thousands of developers, right? We're never going to have this in Dominica. So we have a very small team, but we want to have a major impact. So even though the artificial intelligence is not perfect, where we can prompt it to give us exactly what it wants, really and truly gets you 70% there. So now instead of an individual needing to work on that 70%, we will generate the 70% and focus on the last mile, right? So this is how we would use it internally. But we, like I mentioned, we also partner with this AI factory out of South America. And with that, we are able to now provide custom AI solutions based on your problem statement. So one project that we're working on is to create an advisor that would be able to access data from a defined data source. Because it's for a very large organization, I can't really speak to it in detail. But what it will do, it will use that organization's data. And when the director of that organization is going to visit a particular country, you can prompt it to give you talking points on the current status of that country. And it will generate the talking points as well as the PowerPoint presentation automatically. Then now that information will be proofread by experts within that organization. And so a process that would have been much lengthier, and the director would have gotten, I think, gets about 300 plus invitation to visit countries in like 6 months. Okay. So this is a problem that we would not see from our perspective, but when you sit on top of these large organizations, there are different issues. And so this function, it does not take anybody's job away, but it drafts it, right? And so now you have the administrative assistants, the experts, who would then be able to read that data, approve it, and now the director can speak to that. Okay. And so that's just one example, an application of AI, an AI solution. Any mundane task, really and truly. If you don't mind, if I segue in, my other company, Open Solutions, we provide business solutions for companies. So if you have a pharmacy, if you have a supermarket, any business, we have technology which are fit for purpose. We can tailor it to your needs, and it is affordable. So we bring affordable technology to the domain. And really and truly, our vision for this particular venture is to be able to take small businesses and help them grow to medium to large by using technology that would help them advance faster and grow quicker so that they can compete with other larger companies, especially outside of Dominica. We really care about competing in the regional, international market, not necessarily locally. And so I'm going to use that to segue to say, in certain countries, I understand them looking at AI as a threat. Take, for example, if you're in the US and you have a lot of people looking for jobs, and you have a lot of persons who have gone on and they have their PhD, but yet still they're driving a taxi because they don't have access to jobs. Whereas here, the issue that we see is we don't have these expertise, right? But what if the AI can now come in and give us access to services that we would not have had without the AI? Let's say using computer vision, for example, right? You can take a picture, an image. Actually, this is a project I worked on here with my mom, Dr. Hazel Swinford Ricketts, and she worked with the London School of Tropical Medicine and Hygiene on a project to show how you can screen patients for diabetic retinopathy by using a cell phone and training a nurse in the district to just take a picture of the eye. Previously, my mom had to visit every single health center manually. She's getting older. This is not a sustainable model. We had one eye specialist at the time. Now we have some more. Yes, but is it still sufficient for our population? But now we can just take an image using the computer, and the computer will analyze that image and say, you need to go down to the hospital because you look like you may have diabetic retinopathy.
Okay, so the nurse takes an image, a picture of the eye,
yes,
and analyzes it right there.
Yes, no, yes, the phone.
On the phone,
yes,
the phone, yeah.
Yes,
Okay,
it tells you immediately that this person needs to be. It doesn't give you any like percentage or whatever. It just tells you now need to go see the app.
So what did you have to do? An app, a special app for that?
We did not develop the app. We worked with, and this was as I said, London School of Tropical Medicine and Hygiene. I believe this particular application was developed by an Indian company.
Yeah.
And they had a project to like a proof of concept. So what happened was my mom would screen the same patients as the AI to see how accurate the results were. And I believe it was, it's published, you can look it up, but I believe the percentage was very high.
Okay.
Past the acceptable scale. So this is a real local example of how artificial intelligence would enhance our lives as locals. Now, if you apply that to any area, think of any area that we are stressed on. Let's say, oil depot is a problem. It can provide that oversight. It can provide that assistance to ensure that things are more efficient and things are performed as they should, right? Because you're not going to train that. Remember, we're talking about very specific AI here. It's not going to go up and do it soon. It's not going to have an opinion. Say,
is this an example of narrow AI or is it narrow AI?
Narrow AI.
Right.
A general AI would be you literally have that AI would have a title, a job title as whatever, in there, and you would just tell it, you are responsible for that domain. You respond, and it will figure everything out.
So in what you're doing, Peter, you're employing narrow AI in everything that you do at this point in time.
Yes.
Okay. In terms of preparing for the future, what's your company doing in that regard?
Very good question. That is such a good question. This is actually something that my co-directors, so Mr. Robert John and Mr. Mahalis Alcendo, we sit and try to ensure when we invest, because the way we work actually in our company, we wanted to solve another problem, not just technology. We wanted to solve the problem of brain drain in Dominica. And so what we do is we would employ persons from the state college. Actually, we would track them from high school, give them an internship in the state college. If they meet our criteria, employ them, and then we actually pay to upskill them, right? And we, based on the resources that we have, but if we had more resources, we would pay for their, bachelor's degrees and everything. That is what our overall goal is so that therefore they don't need to go out, incur massive debt, and they cannot afford to move back to Dominica because they need to service that debt that they incurred to get the knowledge to come back. And it's been successful so far. So we have persons from the age of 19 on to 26 who've traveled the Caribbean, who've worked with ministries, who've presented, built solutions for governments. These are things that we're doing because the information is available. The same information that AI is using to train itself is available for you to go onto the internet and find it for the most part. And so in preparing for the future, what happens is, let's say we have a tool. We've built expertise on using that tool. And so this is how we are making money, because people are going to pay us as a system integrator to integrate their accounting system with their point of sale system, right? And that requires us having an intimate knowledge of how to map the data to allow for that connection. But now what we're seeing with AI is that it is automatic. There are tools now which are automatic. So literally we could just tell the tool, build a connection between those two systems. It no longer requires our own expertise. So what does that mean? Well, it means that we now need to see how we can position ourselves to, first of all, leverage these AI tools, because they're still tools. They're not out there doing it on their own. You can't just go to this AI company and ask it to do something for you. So the tool needs to be owned by a company. We would learn how to use that tool, which we can now provide solutions faster. And it just means we just need to expand our market space, because we would probably cover so much ground that we would be able to address Dominica quickly. We need to do the Caribbean, we need to do Latin America and the Caribbean. And so this is how we keep our eye on the horizon. And I really want to shout out Robert John, because this man has a way of always dropping these horizon considerations. Have we thought about this, or does this exist? And he would go out, do a quick search, and come back and be like, yo, guys, look at this technology.
So who is Robert John?
Robert John, he's a Dominican. He used to work for the government here. He's also worked in the UK, major consultant in the tech space. And I think he is an excellent person. He's a person that I look to for mentorship, because it's not just that he understands how to build high performance teams and he understands the technology space, but he also is very interested in decolonizing information and decolonizing processes whereby, and he could speak in more detail on this. I would not want to, take that from him, but really challenge you to say, well, yes, here's an example. We talk about medical concepts, but these medical concepts don't take into consideration the medicinal aspects of our, traditional medicine, right? So it's only this, big pharma it caters for. But that's a problem, because in the Caribbean, we have other natural means of knowledge of using the herbs from the forests and so on to address certain diseases. And so therefore, is it fair that we are building solutions that does not cater for that? Right? And so that's where he will challenge how we do things. The cultural competency, that's a term that he coined. I give him full credit of that. Cultural competency. So when we work, you could ask the government of St. Lucia, you could ask the government of Grenada. When we meet with governments and we do projects, they say, we want to work with companies like this. Because it's not someone coming in from outside of the region who does not understand our cultural challenges or, the nuances of our environment. And so when we build solutions, we build them fit for our purpose, right? So instead of us having to conform, it conforms for us, right? And yeah.
All right. Okay, let's look at other areas in which, obviously you're talking about the positive ways, right?
Yes.
Which AI can impact the region. You've given some specific examples. But Mark was also mentioning earlier on that there are some concerning, ways that should be of concern. Should be of concern, to us, right?
Yeah.
If as regards AI and its development. Yes, Mark. Maybe perhaps you should start this.
Well, it's a kind of a complaint in a sense that we didn't anticipate what was going to be coming. So we were not prepared for that at all, because the people there are a fair number of young persons who are employed at these companies providing customer service over the internet to outside clients. The outside clients can easily and the reason they were here was because the cost of labor to do the customer service was lower here. Now the capital that will be deployed through the instrumentality of AI can replace labor entirely in doing that kind of work, which means that since we don't have the capital here, the capital is back where the firm is. The firm will no longer need the cheap labor here to answer the phone and give service to customers. Will go back onshore to AI system.
Right. Which
brings up the question of what do we do to get especially those young persons who are still at school, few as they are, up to standard, so that they can participate intelligently in the digital economy as sellers of digital goods and services on the internet. Like Peter is a good example that the young persons at the college should be emulating, because he does important in two things. He's an entrepreneur, Entrepreneur is a French word.
Right.
Means undertaker. Not the one who puts you to not the one who puts you on your last journey, but he undertakes to bear the burden of starting a business of some sort. Yes? And because of his skill, he decided he wanted to undertake the business of getting involved in tech, right? Particularly in programming, on the programming side. But there are two divisions to the tech, by the way, people kind of forget. One is the actual machine, you know, with the chips and all of that stuff there. And then they are the one of building the software, right, which is probably more valuable. Yeah. So he is in that space. And the young persons who are coming up would be thinking of joining him, either starting their own company or starting it in cooperation with others and start small and have ideas. For example, everybody loves music. Everybody remember a guy called Sean Fanning. Well, Sean Fanning is famous for having invented peer-to-peer sharing of music. Okay. It's practically bankrupted the whole multi-billion-dollar music industry. He's a 17-year-old guy because he upended the entire music industry. Now everybody's listening to MP3s and so on, but he is the guy who really started that. And in Sweden, for example, there are two subjects all children up to secondary school must study. It's computer programming and music. And most people will be surprised to know a lot of the music that they hear being sung by Rihanna and people, you assume Americans and so on, and British, are produced by Swedes. Especially because they have these two skills together. They know music and they know computer programming. The person who invented Skype, the Swede, and when he invented it, he said his objective was to put telephone companies out of business. So all of us are using WhatsApp, and Skype itself has kind of become old school. So we moved on to WhatsApp and Zoom and so on. But his aim was to do that, and he's a Swede. Spotify is the first and biggest streaming platform in the world. It's programmed by a Swede. You know, in Sweden, that's where Facebook, matter of fact, when you send things to Facebook and so on there, a lot of your things pass through Sweden. That's where they have the largest server farm. Part of the reason they have that large server farm in Sweden is because there are lots of people who can program the computers and keep them running. Yeah, as well as it's cool in Sweden, so you don't have to spend so much on the air conditioning.
What sort of effect has this phenomenon that you're talking about had on Sweden's economy? I mean,
Sweden is a developed economy for sure. It's a small country, as countries go, but it's a pretty well-developed country. People have a high standard of living.
Right.
You know?
Okay, because we were talking about getting involved in the developing the digital economy by getting more people involved in programming and so on.
So within our own sphere, although we are elite, we have to get computer programming banalized, generalized, so that.
So in other words, you I could deduce from what you're saying that you're suggesting that well, not computers, but the digital economy is the future of this country.
Of everybody.
Well, we're talking about Dominican and Caribbean.
Just to say something. If you are not computer literate, when you say you're able to write some code and so on in the 21st century, no, you are illiterate. Just as you were illiterate when you went to school, if you couldn't write your name on your slate. Now, if you can't program a computer to do something for you, you are illiterate in the 21st century.
Right, because obviously, Peter, if we are to seriously pursue development of the digital economy, right, which you have already started, that is what you do, and you've already talked about doing business in 5 Caribbean islands, right? So it seems to me that obviously we have to look at the export market, right, for that, because our own economy or population or business sector, big companies like Peter's, we're not going to be able to sustain a lot of them in this country locally. So you'd have to look towards
no, I mean that's
the
most
outside.
Most of our income is
from the outside.
From the outside. Like I would say over 90%.
Okay, but okay, well, fine. So essentially, if we're getting more people involved, then that's what we need to look at. What is your take on the receptiveness, right, of our locals to the whole idea of AI?
Man, I'm gonna tell you something though. In terms of technology adoption in Dominica, there are some non-technical prerequisites that needs to be addressed. We have attempted to work with, do a few projects here locally, and the challenge that you would have, and AI is not going to solve that challenge, is the structure and the manner in which companies here operate. You have persons with MBAs for a reason. You have persons that are logisticians for a reason. I say that to say, let's say you have some business a retail business, right? So you have a warehouse and you are storing goods and you are selling those goods. You're marketing those goods. The processes that the company use to run their business is where the challenge lies, because technology supports processes. So even if you were to ask an AI to build a solution for you, it needs to understand how your business works. The problem is that because of certain challenges of our environment, I don't know if you know of the you're supposed to separation of responsibility, right? And that is as an accountability measure. Unfortunately, because you don't have the revenue to employ the requisite number of persons, you have one person being responsible for too many things. Yeah. And so, yes, you could build software for it, but it's still not going to solve some of the big problems that we face when we speak to clients. And mind you, technology is a tool like no other. You only approach technology to solve a problem. Nobody just computerizes for the sake of computerization. The first thing you have is a problem statement. Why do you want to why do you want to transform your company? You want to make it more efficient, more profitable. You want to understand more insights into what's happening. But your company is based on these processes, and if these processes are not optimized prior to building and producing a software, the software is still not going to solve the problem. And so you can find failed projects because you are not addressing the prerequisites before you introduce the technology. And if you look overseas, you would hear of persons that have, Six Sigma, which are persons trained on optimization of processes, and you have logisticians. So if you're doing your warehousing, it will tell you how to stack your shelves and your ordering cycles to make sure your expired goods do not expire by the time, understanding how quickly your products move and so on. You need that expertise to do so. Now, mind you, here comes AI. We as a technology provider, I may not be a logistician, but I know you need a logistician, so I can prompt the AI to try to understand what I need to tell you, at least to consider before we build a solution, because I don't want the product to fail. So I'm going to say, well, how do you manage this process? Okay, and then we will look at it. We can pass it through the AI and ask the AI to optimize it. So we don't have the in-house expertise, but we have access to it through the AI, and then we can come back and make those recommendations for you and tell you that, well, you must address this before you can computerize anything.
So do you see your role to an extent in being the innovator, being the catalyst to sort of get, because AI is coming,
yeah,
it's already here, and it's coming, in its more advanced forms to us, as we are a small part of the world, and we can't run away from that. So while you've pointed out the challenges that our businesses face in embracing technology and AI, we have to get to the point where we're ready, able to deal with it. So what do we do? I mean,
First of all, I think this podcast is exactly what Dominica needs to prepare. It's sensitization. A lot of people also fear of job loss, especially what now they're seeing. I mean, people may not understand what we've mentioned about the call center, but yes, I believe this is heavily linked to AI from the parent company. So there is this inherent fear that by introducing artificial intelligence, it will take your job. I think what we need to appreciate is that at the end of the day, there will be job transformation, right? But let's not look at the artificial intelligence at this current state as it's going to replace a human being. Let's look at it as it's going to enhance a human being. It's going to provide an assistant that allows that individual to do a lot more, because guess what? Where that individual is working, whether it be government or a company, in reality, they do not have the adequate staffing to support this individual. So this individual needs assistance, and the AI can aid in that aspect. And so sensitization on what AI is, how it is going to impact us as a country, as a society. Just look at how social media has impacted us and our culture, right? AI is going to be tenfold that, exponential. I can't even give you an adequate quantification as to how the vast difference between the impact of social media and AI is going to be moving forward, right? But at the end of the day, the change is happening, whether we like it or not. So by understanding what's coming and positioning ourselves, there is still the opportunity now. Because hear this, how long would it take for you to train up a young person to become an expert? 10, 15 years if you want to send them to college to get their PhD? Where do you think the world is going to be in 15 years? Do you think that person is going to have a job? So how can we fast track that is what I'm trying to say, which is what we're trying to do with the persons from the college. How can we get people working now? Get them productive now? Because these tools are available. They don't need that PhD. That PhD is for if they want to go develop new technology. Right now we need to leverage the existing technology. That's where we should be putting our eggs in that basket.
Thank you, Mark, co-host of Factually Speaking, and to Peter Ricketts, our special guest today. And Peter, again, as we told you at the beginning, is the CEO of Open Solutions for Health and Multiverse Games. We want to thank you two gentlemen, and we want to thank you, the viewers, for joining us. We also want to remind you that there are other podcasts that we have produced, about 6 others so far. This is the 7th, and you can find all of them on YouTube, the DNO YouTube channel, as well as they're also on the Facebook page and the DNO site, main website. So you can look for them, and if you have not seen all of them, then be sure to watch them. We try every time we do a podcast to bring you information that is of interest and use to you as a citizen of this country. Thank you for joining us, and we'll see you next time.